Welcome back to CLE Weekend. In recognition of Suicide Prevention Month, we want to talk about the importance of a critical lifeline, specifically the 988 Suicide and Crisis Lifeline. Joining us this morning is Doug Jackson, 988 Administrator, and we want to talk about a lot. First of all, thank you for coming on and joining us.
Happy to be with you today to talk about this important resource in Ohio.
Yeah, it is. I mean, the impact in Ohio, we really want to talk about that. And really, I want you to walk us through first what 988 is for anyone who doesn't know.
Right, 988 is a three-digit number that was created for the nation, but implemented by each state so that the response to a mental health crisis can be provided to those in need. So 988 is simply a number that people can call. They can also text and even chat with this if they have a mental health need and they need to get some supports.
I think that's key too, that you say it's not just a phone call. There are other options, which we know a lot of people like using other options now to communicate. It's been 2 years since the launch. How has it been going?
The need for it has definitely shown itself, and our ability to respond to that need has also been well planned and well orchestrated in Ohio. Ohio is leading the nation in the ability to answer that need in the state. So we've provided 19 call centers throughout the state of Ohio that are responding to calls, chats, and texts. And we are keeping Ohioans' needs being served by Ohioans in our state.
Yeah, I love that. You know, when someone calls 988, who is on the other line? Who answers that call?
That is a great question, because we want people to understand that they're getting somebody who is local. They're getting local help. Which means that then the person answering that need understands the culture, they understand the resources. But the purpose of 988 is really to have somebody to talk to, whether it's call, chat, or text, and have that party be able to just listen, to provide feedback, and really help to de-escalate that mental health crisis. But if needed, also be able to connect to local resources. That's really the key to being able to get help, is that the help is near the person in need.
So, you know, we talk about a mental health crisis. I want you to give us some examples, right, of why people would be calling 988, maybe what they're going through. And also, if we know someone who has been through this type of stuff, that we can encourage them that there is this outlet of calling, texting, chatting by using 988.
Now, a mental health crisis is really defined by the person, because each person can manage their own life the way that is best for them. Some can overcome challenges mentally, and others might hit a wall that day and just need additional support. So a mental health crisis could be anything from just the inability to cope with the stress of that day, whatever that stress might be. It could be from relationship matters, drug use, could be thoughts of suicide, but it would be anything that the person is unable to cope with on their own.
Yeah, and I like that it is specific to each person, because the mental health issues that we deal with are all different. I want you to explain too, a lot of us know 911. How is 988 different from 911? Again, we know an emergency we call for 911, but I kind of want to hear in your words. Break that down for us.
Right, 911 is there for police, fire, ambulance, really for that emergency response that we've become very familiar with when the need arises to need one of those public services. But 988, being that it's 2 years old, still people are figuring out, well, what is the use of 988? And we go back to mental health crisis defined by the person, just the inability to deal with what they're dealing with in their life and to have that mental health support to help them through that.
Ahead of this interview, I asked a few people, I was just kind of curious, do you know what 988 is? And the three people that I asked, different people in my life, they all knew. And I was so happy about that, because it is something, right, that you do want to spread the word about. Specifically right now, though, why do you feel it is so important to recognize, bring awareness to Suicide Prevention Month?
Suicide is occurring in Ohio and across the nation. Just in the state of Ohio, we have on average 5 suicides every day. And that number it's just too large. And we want to create a response that allows people to take away the stigma of not feeling well mentally, be able to address that behavioral health need, just like we address physical health needs, talk about things with others, 988 being that resource for somebody to talk to, and really reduce suicide in Ohio, but also reduce the mental health crisis that people are having.
Yeah, I think you talk about that stigma too, that it's okay. It's okay to call. And again, there is help out there. Of course, the goal to increase awareness of 988. Ways that you are doing that, have you seen it successful?
We are seeing more and more people aware of 988. So we first did a study to see many months ago how many people were aware before we launched a marketing campaign, just as a benchmark. And what we found was about 1 out of every 3 Ohioans was aware that 988 existed. Our goal is to make all Ohioans aware that 988 is a resource for them.
Yeah, Doug, how can we help you spread the word about 988?
Well, our goal is to do just what we're doing today, and that's to talk about it, to make it a conversation around the dinner table, to make it a conversation through all types of outlets to share the news, whether it's a broadcast like this or reposting a social media post, talking to friends and family about it. Really, it's just education to start with, awareness that it exists, and then also just building up trust in the system, which we're doing in Ohio by responding to those calls, chats, and texts, and responding in a way that leads the nation. We have the fastest response time in Ohio, so when somebody contacts 988, our ability to meet with them very quickly through those calls, chats, and texts, and our volume is tremendously high. Every month we're seeing now over 20,000 contacts a month coming in.
Wow, that's wonderful to see that number, I'm sure, after the 2 years. Where can we go to learn more information about 988 here in Ohio?
Well, 988 is administered by the Ohio Department of Mental Health and Addiction Services. So the website for Ohio Department of Mental Health and Addiction Services has information on it. You could just Google 988 Ohio and you're going to find many resources, but as well as marketing resources. So we have a marketing webpage, a toolkit for anybody who might want to grab a graphic and put it onto their social media post, or maybe use that in their organization, their place of work, their place of worship. They could post some information to help other people know that it exists.
Yeah, Doug, I appreciate you this morning talking about 988 Suicide and Crisis Lifeline. And like you said, spreading the word, getting the information out there. That is, of course, the goal. Thanks so much for chatting with us today. We'll be right back on CLE Weekend.